at HIMSS 17 talking to Dale Nordenberg, who is the Executive Director of MDIS. Dale, thanks for speaking with us here today. You know, your organization was co-founded, you were one of the co-founders, back in 2010 based on the premise that there really is this higher need for additional cybersecurity and oversight with regard to medical devices and their vulnerabilities. That is certainly a demand that's been confirmed with what we're now seeing in the healthcare sector, correct?
That is correct.
Yeah.
We know as each year passes that the risk from cybersecurity vulnerabilities to any computing device or infrastructure is increasing. As healthcare has been driving to improve data exchange, interoperability, we have created increased risk for malware and other types of cyber vulnerabilities. So what's emerged is that it's important that our nation's healthcare system, which is composed of medical devices and medical device associated networks, it must address the quality assurance and the securing of those networks for each hospital, but then also across networks of hospitals.
And specifically now, MDIS has a close working relationship with the FDA when it comes to cybersecurity and medical devices. So talk about that initiative and what you all are doing.
Sure. We started in 2010, and it was when we just started, we would come to HIMSS, we would come to the Mobile Health Conference, and we would be about the only group talking about cybersecurity and medical devices. It's been very exciting. In the last couple of years, the FDA has really emerged with excellent leadership and has created public workshops that we've participated in. We're very excited that in October 2015 that the FDA, the National Health Information Sharing and Analysis Center, NHISAC, and our organization, MDIS, signed a collaborative MOU to build 2 national programs to share cybersecurity related information for medical devices. This is really important. One of those programs, which is called MD Viper, which is the Medical Device Vulnerability Intelligence Program for evaluation and response, is finely tuned to support the recently released FDA guidance. That came out in December 2016, and it says that manufacturers who identify a vulnerability in their medical devices that may cause patient harm, but have not caused patient harm, they can actually report that vulnerability to MD Viper, which is a service run by NHISAC and MDIS. So that's one of the programs we're doing, and then the second program is called the National Cybersecurity Surveillance and Safety Network for Healthcare Technology. Now this is very exciting. This is a robust, comprehensive surveillance initiative to look at what kind of exposures there are to medical devices, malware, intrusion, how that's impacting the medical device, and how that in turn may impact patient care, quality of care, and safety. So this is really, from a cyber perspective, the first full-blown public health initiative to tie cyber to population health.
And so important for that kind of oversight. I hear so often that, you know, the technology develops and is implemented because there's all this excitement around having a new device that can impact population health, impact, you know, patient outcomes. So the device is developed, but the security is lagging behind and isn't, you know, quite where it needs to be to really secure the device. So having that kind of oversight really does help bridge that gap and make sure that the devices that we're implementing are secure.
That's correct.
Yeah.
All comprehensive, all strong public health initiatives start with the data. So what we need to do is we need to define the exposures we're interested in, define the weaknesses we're interested in, start to count those. Because right now we assume there's risk. We see non-medical devices, regular IT products that have vulnerabilities. We see the impact of those vulnerabilities, but we haven't seen yet that counted, that described and counted for medical devices. So all we can say is we know there's risk, but we can't describe it or quantify it. Once we can describe and quantify it, then we can actually implement public health programs to help manufacturers build better devices, to help healthcare systems build safer medical device networks. So this is a first but very, very important and critical step to securing our nation's digital health infrastructure.
Dale, thank you so much for your time and your perspective here today. You're watching HIMSS 17 TV.